Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video, we will be learning about a DABT topic rather than discussing a question. We will be dealing with the topic. So the topic title is dose, internal exposure and external exposure. This you will come across in chapter 2 in lesson, okay, in the principles of toxicology. So let's directly dive into important point that one we can learn from this particular topic. Let us first understand what is dose. Dose refers to the quantity of chemical introduced into a biological organism in a given period of time. Dose can be expressed in many different forms. The most common form is weight of the chemical per unit weight of the experimental animal given on a single occasion. So unit will be mg per kg. For repeated daily dose, mg per kg per day. Okay. In case of repeat dose toxicology, where you have dose descriptors NOAEL or LOAEL, the units will be mg per kg per day. Whereas in the case of acute toxicology studies, the unit for LD50, where the dose descriptor is LD50, the units will be mg per kg. A total daily dose may be divided into several small doses administered at specific intervals. Example mg per kg every 6 hours. This you will come across in case of inhalation studies. Okay, this type of units. Next, a dose may be expressed as weight per body surface area mg per meter square BSA. This particularly will come across dermal studies as well as in case of anti-cancer drugs. Whenever you are working on cancer drugs, since the body weight will change in case of cancer patients, the units will be mg the units will be mg per meter square based on body surface area. When comparing organisms with large size difference, example rodents versus humans, dose can also be defined by concentration per unit of the exposure matrix multiplied by the number of units to which the organism is exposed in a given time period. Okay, very important. So apart from mg per kg, certain times, certain studies, the doses will be in concentration per unit of the exposure matrix. Okay, very important, particularly who are dealing with risk assessment. No, you will get the toxicology studies and data in different units. Certain times the units will be in mg per kg, certain times the units will be ppm, certain times the units will be mg per liter or mg per meter cube. Okay, certain times dietary ppm, body surface area mg per meter square. Okay, certain times 1%, 2%, 3%, like that concentrations will be there. That is the reason understanding the units in terms of toxicology studies is also very important. Then only you can apply the risk assessment. Okay. Next slide we'll see a major route of exposure is by mouth. That is oral exposure. Chemical exposure may occur via contaminated food, water or drugs. Okay. Other commonly used routes of exposure include intravenous injection for infusion, intramuscular injection, subcutaneous injection, intraperitoneal injection, inhalation, installation, as well as topical application. This will be in the case of ophthalmic route, and this will be in dermal route. Internal exposure versus external dose. Pharmacokinetic movement of chemicals through the body. Pharmacodynamic, body's biological response to the chemical. Parameters determine the amount of external dose in blood circulation and targets. The internal exposure is affected by the rate of absorption and distribution from the administration of an external dose into a given biological matrix. This is sometimes referred to as bioavailability. So I would request you a question. Go back and clearly see the difference between what is bioavailability, what is absorption of a drug. Those are working in the case of risk assessment. If you want to do any root correction for a certain chemical, okay, the absorption of bioavailability is available in certain route, but you have to do root correction by applying certain adjustment factors. So what you will be considering, whether you will be considering absorption in terms of percentage or you will be considering bioavailability. So go back, take this as an assignment and go back and check. Also, you check if in case absorption for a certain chemical is not available, then how are you going to perform your risk assessment, right? For example, are you going to use predictive absorption of that particular chemical, or are you going to use a surrogate or read-across approach to estimate the absorption of that particular chemical, or are you going to use some in silico tools like drug diagnosis tool or top tree in order to predict the absorption? So look into these type of questions because examiner will ask such type of questions. Okay. Then next we have distribution of a chemical among different biological compartments. What are these biological compartments? Blood, cerebrospinal fluid, bile, lymph, urine, milk is affected by the solubility of the compound. This is very, very important. Physicochemical properties of a compound of a particular chemical is very, very important in different matrices. Again, the matrices is, if you look at the any cell, typical cell membrane, it is made up of phospholipid bilayer, right? So in order for a chemical to penetrate to this phospholipid bilayer, the physicochemical characteristic of the chemical is very, very important. Okay. So that's why here it is saying compound in different matrices, whether it is aqueous or it is fat. Rate of diffusion. So this will again depends on the concentration gradient, or is it facilitated type of distribution, or is it a active transport, like sometimes ATP driven type of transport mechanism, and the presence of active and passive transport mechanisms, right? Uptake and distribution are also affected by chemical properties. So in the previous thing we have understood the physicochemical properties. So whenever you are doing a certain risk assessment, you need to understand the physicochemical properties of that chemical. Similarly, here also we need to understand the chemical properties like lipophilicity, hydrophilicity, pK of the compound, and pH of the matrix. See, same chemical will have absorption. The rate of absorption will be different in the stomach because of the acidic nature of the gastric fluid available in the stomach. Uh, Intestine it will be different. If it is vaginal area, it will be different. Understood? So in our body also, different regions are there which are having different pH states. Okay, so that will facilitate the type of absorption of that particular chemical. Okay, certain times presence of another chemical will also influence the absorption of the chemical which we are studying. Okay, next, rate at which a chemical is metabolically activated also determine the internal exposure experienced by the target cells. So this is very, very important. So in this video we have learned about what is dose, what are the different units of doses. Okay, not always mg per kg, it will be also in terms of concentration, right? I will also suggest you, whenever you are doing dietary conversions, there is a table given by EFSA where 1 mg per kg per diet or 1 ppm of diet, how it is converted into mg per kg. Those conversions, those tables are given in that EFSA. So EFSA dietary conversions will be there. One guideline is there. Please go and read. Okay. And those who are working on solvents, for example, those who are working on ICH Q3C, if you want to convert mg per liter or mg per meter cube or this type of solvent studies doses conversion to mg per kg, please you can go through ICH Q3C. There are solved examples are there where they have given stepwise how mg per liter is converted to mg per meter cube by using this PV equal to nRT equation, right? Based on molecular weight of that particular chemical. Okay. Then finally, how you can convert the dose into mg per kg by applying even the duration correction, like 5 days per week or 6 hours per 24 hours. In one of my video, I will also explain about PD, how to calculate permitted daily exposure. In that, you will come across the steps how you are able to convert these dose conversions. Okay. Apart from that, also try to understand that other type of studies, like there will be ophthalmic studies where you will be instilling the drug in terms of drops. Okay, one drop or two drops into one eye. or 2 drops per 2 eyes, 2 drops in 2 eyes. Okay, 2 drops or 2 eyes in twice a day or thrice a day. So if you want to calculate what is the total dose in that particular day, then you have to know how to uh, convert these ophthalmic doses. Okay, 1 drop, how much is there? 50 microliter, some will be there, and also based on density and concentration, also concentration of the medicament also. So these type, including dermal studies. In dermal studies also, you'll come across that one pinch of a substance has been applied and so on, so therapeutic application area, like that you will be getting. Then how to calculate the doses? That becomes a challenging. So try to understand there are different types of routes of administration: oral, for dermal, for inhalation, for ophthalmic. Okay, all these things to try to under, and also pediatric doses. Certain times pediatric doses, and certain times compromised condition patients like renal patients or liver failure patients. How we are going to do dose adjustment in this kind of patients also. So spend some 1 2 hours only on understanding what are the doses. Toxicology studies are there, doses are there, literature is there, data is there, but you are unable to use the data. Then that will be very challenging. So hope you have learned some kind of information from these from this video. Okay, all the best for your exam. Okay, be curious, like, subscribe, and follow my YouTube channel Toxicology on Board.